Hi, I'm Dr. Alan Olo Austin, the originator of Trigenics, and we're here today at a Back to Health class that's being done especially for you. If you're at home and you're not able to attend one of these classes and your doctor has given you this tape, then you'll be able to share in our Trigenics Back to Health class. So I've got a small class here with us today, and we're going to just ask you a few questions, if we will. Myrna or Lorene, maybe you could answer this, or Hun. I'm going to ask you something first about chiropractic, because in this class what we're going to be doing is we're going to be talking about chiropractic care, and we're going to be talking about Trigenics and how the two interrelate and fit together to provide complete care for you and for any conditions or problems that you or others may have. But first I want to know what you know about chiropractic. So let me ask you this. Let me ask you, how many years does a chiropractor have to go to school to become a chiropractor? That's just the first quick little question.
I think it's 5.
Lorene says 8. Myrna says 5. 4. God, we got 8, 5. Do I hear?
6.
8, 5, and 4. 6. 8, 5, 4, and 6. So there's quite a discrepancy in the number of years. So we probably want to clear that one up. The first thing is that a chiropractor is someone that has to have a degree before they apply to the chiropractic college. So a degree is normally a minimum of 3 years, but it's often 4. Just depends upon what university you go to. And after that, once you're accepted into chiropractic college, and it's very difficult to get in many of the chiropractic colleges, but once you're accepted, it's another 4 years after that. In some cases, it's 5 years. It depends upon the chiropractic college in North America. So the minimum number of years, in fact, is 7. Who said 7? Nobody said 7. We had 8. We had 6. Nobody said 7. So Rod, I guess you could have come up with 7 there, but yeah, okay. But the minimum is 7, but many chiropractors have 8 or 9 years. So it's very similar to medicine. In fact, the core curriculum of chiropractic is exactly the same as the medical school's curriculum in the first 2 years. And in the 3rd and 4th year, they differentiate, whereas the medical doctors will study pharmacology and surgery and things like that, and the chiropractor will specialize more in manual medicine and radiology and radiological diagnosis. So the other question then is, can you all hear me? I think there's a...
Yes.
Yeah. The other question is that, is a chiropractor a doctor?
Yes.
Yes?
Yes.
Okay. A doctor of chiropractic. Good. And what does it mean to be a doctor? Well, a chiropractor is one of the 5 professions in North America that's actually able to use the title DR in front of their name. And that's because the government recognizes chiropractors as full doctors with the ability to fully diagnose any condition that comes into them. They're referred to as primary care practitioners. And those 5 professions are medicine, chiropractic, optometry, dentistry, and a doctor of psychology. So those are the only 5 professions that can actually advertise and put the titles DR in front of their name that are recognized as full-fledged doctors and full diagnosticians. Why would a chiropractor have to be that, you ask? That's a good question. The answer is, many conditions, most people go to chiropractors for what?
Pain.
Pain. Where usually? Where though? In their back and their neck, but you know what? That's really starting to change with all the baby boomers getting over. A lot of patients are now going to chiropractors with arm pain and elbow pain and golfer's elbow and plantar fasciitis and knee problems. And Hun, who's a taekwondo expert here, is nodding her head, understanding all about those types of aches and pains. So it's changing, but yes, most people go with the back. And guess what? There's a lot of cases where patients come to chiropractors for back pain, but sometimes that back pain is actually being caused by something far more sinister than just a muscle or a bone or a nerve being irritated. And in fact, it may be the only symptom of something very sinister, like a gallbladder problem. Classically, we refer up to the shoulder area in the back, or some people with tuberculosis, or with terrible forms of cancer, or various other stomach problems. It just depends, but there's many different conditions that will manifest themselves as back pain. So the chiropractor has to be in a position to be able to fully diagnose any type of condition that walks into his office in order to be able to ascertain whether or not that condition is actually within their scope of practice, or whether or not that is something that they would need to refer out to another appropriate specialist. And so that's why chiropractors are primary care practitioners and full-fledged quote-unquote doctors. Not everybody knows that, so I always like to clear that up right at the very, very beginning. Now, the other thing is, what do chiropractors do?
Adjust your back.
They adjust your back. Why do they adjust your back?
Because it's out of line.
Because it's out of line, okay. Well, why is it a problem if it's out of line?
It hurts the nerves.
It hurts the nerves. Very good. Okay, so if we take a look at a spine, I don't have one here, but if we took a look at a spine, we'll see that there's 24 bones sitting stacked on top of each other in a sort of precarious S-shaped fashion from the side. From the front, it's supposed to look like that. But from the side, it should look like this. And those 24 bones that sit stacked on top of each other, not my artistry is not the greatest here, but those 24 bones that sit stacked on top of each other, let's do just two of them, let's single out two here, they have a notch in the bone above and a notch in the bone below. And that notch, not that I'm able to draw very well, but that notch forms, what happens when you take a notch above and a notch below? What do you get? You get a hole. And so between each of these bones, like I said, I'm not a great artist, but between each of these bones, there's small holes on either side. And then down through the center of them, there's quite a large hole, about that big. And what does that large hole accommodate?
That's the movement.
The large hole down the center accommodates the spinal cord. And the spinal cord is a direct extension of the
Neck.
The spinal cord is a direct extension of the brain. And what does the brain do? That's the master controlling system of the entire body. It controls everything. It controls movement, it controls your muscles, it controls your immune system, it controls my lungs breathing right now when I'm not thinking about it, it controls my heart beating, it controls everything. So would it be important then for all of the messages from the brain, the messages that exist? By the way, your brain and your nervous system is the first thing that forms in the first 3 weeks of your life. It's the first thing you actually differentiate when you're a zygote, when you're just a little clump of cells that are beginning to differentiate. And after the first few weeks, when they actually look at it microscopically, the first thing they see is the remnants of the brain and the spinal cord. Those are the first cells to differentiate. Why would that be? Because they have to control and coordinate the formation of all the other cells. And then as you continue on through your life, it controls and coordinates all of the activities and functions of your body. So it's very important for all of those messages to get down through to the different areas of your body from the brain 100%. If only 60% of the messages were getting through from the brain to the lungs, for instance, and a germ were to invade the body, where would it invade?
The heart.
Okay, 60% of the messages are getting through to the lungs, and 100% are getting everywhere else. And a germ were to invade the body, would it invade the area that's the strongest or the weakest?
The weakest.
And if there's only 60% getting through the lungs, that tissue would be weaker than the rest. And so you might have a little asthma or some lung problems. And patients that see chiropractors, not only do they get relief for their pain, the pain that they have in their back and their neck and other areas, but they often find that other things improve dramatically as well. Some patients with asthma, for instance, when you work on the areas where the nerves are that go to the lungs, find that their asthma improves drastically. People with stomach problems or gastritis will find that clears up. Constipation, many different conditions respond to chiropractic care. Why does that happen? Well, there's something that can cause interference with the normal transmission of messages from the brain to the body. And that something is on this little chart that we made up here that we're gonna go over with you. And we're going to go to this part of the chart right here. On the right-hand side, second down from the top, we see two words. What are those two words? On three, we're going to say them together. 1, 2, 3.
Subluxation.
Okay, let's just do the subluxation on three. How's that? 1, 2, 3.
Subluxation.
Subluxation, very good. Now, what, you ask, is a subluxation? Well, a subluxation is the one thing that can interfere with the normal transmission of messages from the brain down through to the different parts of the body, because The brain, which is really contains what we call innate intelligence. The brain doesn't need any help, it just needs no interference. It knows what to do. It knows how to heal cuts. It knows how to keep your heart beating. It knows how to keep you breathing and keep everything doing. It just needs no interference. So if those messages that come out and go to all the different parts of your body, if somewhere those messages are getting blocked, that is where there's going to be eventually some problems developing in that area of the body where the transmission doesn't get through properly. Now, if we remember that these bones, the 24 bones that sit stacked on top of each other, have holes that are existing between the notches, and the spinal cord goes and carries all the messages, like the big master telephone line, carries all the messages down through from the brain to the different areas of the body. If at that notch level there's some interference, it's called a vertebral subluxation. And what exactly is that? Well, somebody said out of line. Now, out of line is kind of sort of the old school of thinking, but to some extent it's true. The new school of thinking is that the bones that sit stacked on top of each other have a certain range of motion that they have to be able to move through. That's the normal range of motion that collectively allows us to bend and do all of these different movements. Each bone has a little range of motion that it has to be able to move through in order to allow for proper bending and movement. Now, around these holes is a certain amount of tissue, just enough tissue to contain the nerve that comes out from between there. I mean, that's what I was going to ask you, is what the holes are for, but I've answered my own question. So there's 31 pairs of these holes, and what they do is they accommodate all of the nerves that come out from between those bones. They accommodate the 31 pairs of nerves that are direct extensions of the spinal cord, and these are the nerves, the 31 pairs that come out from between these bones that transmit all of the messages to the different parts of your body, whether it be to control the muscles for movement, and there are also nerves that also receive messages as well as transmit messages, because messages also have to be received and transmitted back up to the brain from the body, so the brain knows what the body's doing at any given point in time so that it can regulate all of the different systems appropriately. So when the bone gets stuck and it stops moving properly, it can cause irritation to that tissue that surrounds the nerve, and if tissue becomes irritated, what happens to it? It becomes inflamed. If it becomes inflamed, what happens to it? Does it get bigger or smaller?
Larger.
So if it gets bigger, what happens to the size of the hole?
Decrease.
It gets smaller. And they've shown that only 3 microns of pressure is enough pressure to actually cause interference of normal nerve transmission. That's like 3/1,000,000th of a millimeter of pressure can interfere with the normal transmission of messages. So when the bone stops moving properly and it causes interference with the normal nerve transmission, that's referred to as a vertebral subluxation. That's what we're talking about. And that can interfere with the normal transmission of life force or innate intelligence that is transmitted from your brain to the different parts of your body, interfering with optimum health. And so therefore, when you have a vertebral subluxation, you are going to take a look at here. We've got health care over here and sick care over here. We've got birth, and we follow this line, and then right about here the line gets kind of dotted, and at the end of the line we have RIP. You guys know what RIP stands for? Rest in peace. Okay, so we see over here at birth we have 100% function, and we see over here we have 0% function. Now on this scale, where would you rather be? Closer to the left side or the right side? The left side, I think so, huh? But there's certain things that you have to do to be able to stay on that left side. And we're going to talk about what all of those things are in a minute. But before we do, let's take this down for a second, and let's talk about the vertebral subluxation again for a minute. Now, what can cause a vertebral subluxation?
Injury.
Injury. What else? Illness. Okay, let's take a look again at this chart. We have some clues here. What are all these things? Chemical stress, physical stress, emotional stress, spiritual stress. Chemical would be like a trauma or an injury or some physical strain. Chemical could be all the things bad things that we breathe or eat or exposed to or drink. Emotional stress creates a tremendous amount of tension in your muscles, doesn't it? You know why that is? Do you know why that is? Because the nervous system is designed from hundreds of thousands of years ago to respond to certain types of stress in a specific way. And when we're exposed to stress, the nervous system doesn't know the difference of whether or not it's a saber-toothed tiger at the cave ready to attack your family, or whether it's just your boss telling you, you better get that done by Friday or you're fired. Both of those types of stress, the nervous system actually responds to in exactly the same way. And that's called the fight or flight mechanism. And when that is engaged, guess what it does? It causes all the muscles to tighten up. And if that fight or flight mechanism, that stress stays there for too long and those muscles stay tight for too long, guess what happens to them? They actually become hard. They become almost scarred because they can't function properly, and because they collect a lot of the waste material collects inside the muscle and isn't managed properly or excreted from the muscle, and it causes scarring and hardness. So how many of you feel like you might have some hard knots there that have been there forever, and some people have had difficulty, getting rid of them until you discovered Trigenics, right?
Yes.
Okay, so we're going to get to that as well. Now, let's put this away again and talk about the subluxation one. Get back to that. So, who has subluxations? What controls the bones, first of all? What creates a subluxation to develop? We said stress, we said injury. What actually controls the bones? The movement of the bones. The muscles, right. The muscles control the movement of the bones. The bones by themselves don't do anything. They're just inert structures that do nothing. So if the muscles become tight due to stress, due to the fight or flight mechanism, or due to strain or injury or anything, do you think that if they tighten up more on one side than the other, that'll cause a subluxation to develop in the spine if those happen to be the muscles attaching to the spine? Of course it will. And if that stress isn't relieved and that imbalance in the musculature isn't corrected, do you think those subluxations will stay there? Well, what if you even tried to move the subluxation and put the bones back into line or back into place or restore the mobility, which is really the current train of thought? What would happen? Would they probably go back out again? They probably would if you didn't fix those muscles up, right, that are holding them. So now what we're doing is we're starting to talk about integrating another approach to making sure that, how many of you had, before you experienced Trigenics, experienced going to receive chiropractic care and felt as if often the same subluxation, that same area that was adjusted, would keep coming back again? How many of you have kind of experienced that? And how many of you now experience that now you don't seem to have to go as often? You don't seem to have to get those areas adjusted. Isn't that right?
Yes.
There's a reason for that. We're going to talk about that. And that's why we're going to talk about Trigenics as being the missing element in chiropractic care, and why you've discovered it is. And you're here because you want to know why it is that you've gotten these types of results. And we're going to talk about that in a second. But first, we're going to go back to, again, this thing, the subluxation. Now, what does a chiropractor do to correct a subluxation?
He makes adjustments.
He kind of moves the bone.
Yeah.
The problem is, if the bone keeps going back out again and keeps doing it over and over again, you feel like you have to keep going forever, and you never quite get really complete improvement. And that was the same problem that I had for the first 15 years of my practice. I've been in practice for 25 years now. And in the first 15 years, after about the 15-year mark, I began to really look at my practice and realize that my patients kept coming back with the same subluxations, and I kept adjusting them over and over again. And a lot of people would say to me, oh yeah, chiropractors, yeah, I know all about them. You go to them, got to go for the rest of your life, and geez, we would get these types of comments. And so I thought, there must be something else. There must be something else. There must be something more that we're missing, that's missing here. Something that I can do that will cause these adjustments, or this manipulation, these adjustments that we do to correct the subluxations to actually hold and to stay in place. So we started thinking, well, what controls the bones? The muscles. And so we started doing some work on the muscles. Got some improvement, and it actually seemed as if it helped a fair bit. And I thought, okay, that's great, but then it still wasn't quite there yet. And then we started thinking, well, wait a minute now, what controls the muscles?
Nerves.
The nerves. Aha, the nerves control the muscles. So if the nerves aren't telling the muscles properly what to do, and they're in that fight or flight mechanism, and they're sending too many signals to the muscle, and the muscle's staying tight, I guess we have to somehow work on the nerves first to restore the way the muscle's working, to allow the bone to start moving properly and freely and to take the pressure off the nerves that are transmitting the messages from the brain to the body. So what chiropractors do is they adjust and they manipulate the bones in order to allow these messages to get through to all of the different parts of the body. So what they want to do is they want to open up the proper messages. But we had to figure out, and there's a problem with that, as we know, because these adjustments don't really hold as well as they should. So we had to figure out how to change those nerve messages to the muscles. And then we began to realize, or I began to realize, that there is the brain and the messages coming down. Okay, so with chiropractic, by adjusting those subluxations, adjusting those bones, we could open up the transmission of messages coming down. But what was it that really controlled how the muscles were speaking to all these are supposed to be muscles here. There's going to be all these muscles holding the bones here. And if this one was a lot tighter, then this side, this bone would be kind of twisted a little bit, and it would be turning in that direction. It would be twisted, and it would be causing some irritation to the nerves. And so what we have to do is we had to figure out how to change the way that the brain was telling these muscles to behave. Now, what we also know now is that inside these muscles are little sensors that are actually nerves that carry the messages from, say, your arm muscle. That would be your arm muscle here. There's little sensors inside these that carry the messages to the spine and up to the brain, telling the brain what this muscle is actually doing. And why do those sensors exist? Well, first you get the messages from the brain coming down to the biceps, telling the biceps to contract. Brain says biceps contract, so biceps begins to contract and you hit yourself in the head, right? No, you don't hit yourself in the head. You don't hit yourself in the head. Why don't you hit yourself in the head? You don't hit yourself in the head because the brain is also receiving signals from the biceps as it begins to contract from those sensors inside there that regulate the speed of the contraction and then put the brakes on, and that also tell the other muscles over here that they have to relax in order to be able to coordinate the movement properly, or relax or tighten up to slow it down. And those sensors feed the brain with messages coming up. So essentially what you've got is you've got messages going down. If this is the body, my art's terrible, I know. And you also have messages going up to the brain. And what chiropractors do is they open up all the messages coming down to the body by removing the subluxations, albeit temporarily often, so that the brain can communicate, and great results happen, and people start breathing better, and all of these pain is relieved, and so on and so forth, until the subluxation comes back again. So what if this, now we're thinking no longer just the body, but we're thinking the muscles. What if the messages, when you open them up by doing the subluxation, coming down to the body and the muscles, what if those messages aren't the right messages? We've opened them up, but they're not the right messages. Then the muscle's still not going to work properly, is it? No. Well, what we discovered was we had to adjust this feedback system. We had to adjust the transmission of messages from the muscles to the brain with Trigenics. And over here, we have chiropractic. So with the chiropractic, we open up the messages coming down, but first we fix all the messages going up to the brain so that when we open these up, the proper messages are coming down. So this is the other half of the equation that was missing. That's why we call Trigenics the missing element. Because this for the longest time, had never been addressed until we started doing Trigenics. So what Trigenics does is it opens up all the messages from the body to the brain, and chiropractic care will open up all the messages down from the brain to the body. And by opening up the messages from the muscles to the brain, we also regulate the proper messages get down to the different muscles that control the movement, so that those muscles are now working properly. So when you do the adjustment, it holds, because there's nothing there, no longer any imbalance to pull it out. Now, we've discovered something. We discovered that when the muscles become damaged, injured, or stressed, that they stop sending the proper signals up to the brain. The receptors that tell the brain what to do, and that the brain has to monitor those messages and compare them to the messages coming down saying move. They monitor those messages coming up and the messages going down, and they regulate all the movement according to that. And these messages coming up are called reflexes, a lot of them. And generally speaking, this is referred to as the sensory motor system. And that's what we work with in Trigenics, is the sensory motor system. We change the way we actually manipulate and change the signals coming up to the brain, so we actually trick the brain into re-signaling the muscles in a way that regulates it and normalizes the proper signals coming through. Now, two things happen when you experience injury or stress. The sensors inside the muscles stop sending the messages to the brain, and two things happen as a result of that. The brain then sends either too many messages down, or it doesn't send enough. If it sends too many messages, then the muscle becomes contracted and short. That's scenario number one. Or it can send not enough messages. And if it sends not enough messages, the muscle becomes inhibited and weak. So the muscles either become short or weak. So imagine if there were muscles attaching to a vertebrae, okay, and these muscles were short, and these muscles over here were weak. What do you think would happen to that vertebrae, that spinal bone? It would kind of turn. And instead of it moving like this, it would move like this, only over in that right side where it's short. And it wouldn't be able to go all the way over. And that would cause stress in the tissue, microinflammation response, irritation to the nerve, interference with the normal nerve transmission, and all myriad of problems. Now, with subluxations, do you get pain right away? When you develop subluxations? No. In fact, pain is the last thing to appear on the road from health to sickness. So most people who have subluxations? Could there be anybody in the world that doesn't have subluxations?
If they don't do anything.
No, impossible. They'd have to lie like a blob and then the bones would just, it would be impossible. Everyone has subluxations. So who needs chiropractic and Trigenics then?
Everybody.
That's right. And how long, but how often would you need to see somebody? Would it be wiser to wait until you go into sick care over here? Or would it be wiser to deal with the problems in this healthcare paradigm?
Deal with them in the healthcare paradigm.
So which paradigm are you all in?
Preventative.
You're in the preventative paradigm? Okay.